Good evening. My name's Joanna Innes. I'm the Solon Parent Mentor for Solon City Schools. I'm so happy to have you here tonight to learn more about the Cuyahoga County Board of Developmental Disabilities. Before we start, I want to share two events that we have coming up. This Sunday, we have an event for our preschool students to fourth graders. We're going to be at We Rock the Spectrum for an open gym. We Rock the Spectrum is located over in Mayfield Heights. We'll be there from 12:30 until 2. There is a $6 fee. Information can be found in your PTA newsletter, an email, or on the open Facebook page. Second, we have our next presentation coming up for open on April 11th here at the Board of Education at 7 p.m. We're going to have Hallie Dunn from Belvita Counseling, and she's going to give us an overview of ADHD. She's going to explain how it impacts academics and performance, and she's going to share some of the common challenges that students will face. And she's even going to go over the difference between ADHD counseling and ADHD coaching. So tonight we're here with Amy and Amy from the Cuyahoga County Board of Developmental Disabilities. I'm really excited to introduce you to them so we can learn more about eligibility and application for services for your child. As parents and caregivers of kids with needs, we know the ups and downs of the journey. And I can tell you through the supports of the Board of DD, they ease the load. And becoming a part of it has been a blessing for our family and for many families that I've worked with. And hopefully tonight you'll learn a lot, and it'll spark the interest for you to take that step to apply and take that step towards getting fantastic services for your child. Without further ado, the Amy's from the Board of DD.
Thanks. All right. I'm going to get over here and get my little clicker. Thank you so much, Joanna. Thanks for reaching out to us to have us come and visit your school district and talk with you about Cuyahoga DD services. As she said, my name is Amy Pender. I supervise the eligibility team at the county board. So we are known as the front door of the county board agency. And so I supervise a team of support administrators who help students, children, adults go through the eligibility process along with their parents. And they also, kind of just help from start to finish. So we also have a team of 2 bilingual staff who answer all of our phones at the front door. So when you call our intake and eligibility line, you will get one of them. There's only 2 of them, but they process as many phone calls. They take live phone calls all day long, so they will process as many phone calls as they can. They are actually responsible for kind of getting that record started, getting kind of that first contact with you to tell you what you can expect to go through the eligibility process, what that looks like. They will then get you connected to an eligibility support administrator if there's a qualifying condition to do so. And we're going to talk about what that looks like in a little bit. We also have Amy joining us. Amy McGlynn is an eligibility coordinator with us. I'm excited that she is a part of our team because she actually helps those students that are aged 14 to 22 who are interested in going through eligibility. She kind of helps get them through the process. So she works with the school district directly, she works with the parents directly, and helping them kind of try to get that student through the eligibility process. So she will, with the release of information, she can actually help that parent get the needed documentation. And I'm going to talk about that in a little bit as well, about what that looks like. But she can kind of be a support to the support administrator, but also to the family and the school to kind of keep that communication going with regard to where the student is in the eligibility process. So Amy's a part of our team to help do that. And then We do have a couple of other support administrators that have different focus areas, like with Department of Job and Family Services, and people that are Spanish speaking, kids that are Spanish speaking, we have support administration to help with that. So we do have a couple of specialty support administrators depending on the need. So that's my team. And I have been with the Cuyahoga County Board for 8 years, but I've been in the field of developmental disabilities for 25. I came from another county board, and so kind of once you get in this field, you kind of just never leave. It's just so rewarding and satisfying, and so it's just a great field to be in. So I'm going to talk with you about how to access county board services. But before I do that, I just kind of wanted to gauge a little bit about who's in the room. How many of you are parents who has a child that's already eligible for county board services? That's already receiving something from us?
No, we are not receiving.
Not yet?
3 or 4 times we got application from you, but we are reluctant to apply.
Okay. Okay, that's okay. We can talk about that. We can talk about kind of what the application process looks like, what the actual eligibility process looks like, and then, what you can expect to receive after someone's determined eligible. Okay, so, and again, we are a volunteer agency, so parents do have to agree to work with us. We don't make anyone receive our services, but we are here to support you and your child if they're found eligible, to help them continue to kind of receive those supports that they need throughout their life. Okay? And then how many of you, is there anybody else that has not applied or received services from the county board before? Okay, all right. Okay, all right. Hopefully I will be able to answer all of your questions. If not, at the end of this presentation, I will have some time for question and answer. I may not have the time to go into specific details about your specific situation. I will try to make time for that, but if not, I will leave my card and our eligibility line business card so that you can contact us at any time to talk through what that might look like for you or things that you might have specific to your child or situation. So let's get started. All right, so determining county board eligibility is a 2-step process. Okay, so the first thing that we do, first of all, you need to be a resident of Cuyahoga County. So you do have to live in Cuyahoga. If you live in another county, you must contact that county board for services. So Lake, Cuyahoga, every county in the state of Ohio has a county board of developmental disabilities. So you're required to be a resident of that county to receive those services here. So the first thing that we do, the 2-step process, is that we check to see if there's a qualifying diagnosis or condition. That's the first thing we ask for at the front door. What brings you to us? Then the second step of the process is we are going to assess for either developmental delays or substantial functional limitations. And I'm going to talk about the difference between those and what that looks like in a few minutes. So step 1 is verifying that qualifying diagnosis or condition. So our administrative specialists at the front door, they will say, what is your child diagnosed with? If it's a younger child, they may not have a diagnosis yet, so we're going to want to know, around 3 to 5, we're going to want to know kind of what the delay areas are for the child. Typically, if a child has a diagnosis, that's what we're going to ask for. We're going to ask about. Some of the examples of developmental disabilities are listed here. Again, this is just some that we typically see. This is not an all-inclusive list. There are many, many other diagnoses that we consider qualifying, but some of the most common are intellectual disability, epilepsy, Down syndrome, ADHD, autism. We do have hearing and visual disorders that can qualify based on the level. So it's just very important to make sure that you report any kind of issues that your child is having or has been diagnosed with, so that we can kind of talk with you about the documentation we're going to need to verify that diagnosis. All right. Okay, so then the second step of the eligibility process is that assessment piece. This is broken out into age and by age group. So for birth to age 2, those are the little babies, those are the kiddos that come to us typically through early intervention. So this is kind of the Bright Beginnings early intervention time period. So those staff are looking at documentation to show that there's one delay area that that baby has. So they're going to directly work with the parent. They're going to, get the documentation they need. They may actually even complete an assessment for that. But birth to age 2 goes to early intervention. They do not come to the county board yet until they're age 3. Okay, so I do have Bright Beginnings and early intervention contact numbers on the brochures over there if you have that age group or you know someone who does. Then when they turn 3, that's when they come to the county board for the first time. So from 3 to 5, that's when we're going to we're going to do a record review. So that means that we're going to look at documentation and we're going to actually look for 2 delay areas. So those things could be like social emotional behavior, communication, speech, fine motor, gross motor, adaptive skills, things like that, those areas. Typically that record review is done through looking at an evaluation team report. Does everybody know what an IEP is? Okay. Along with the IEP, typically an ETR, an evaluation team report is completed. That team report is done every 3 years for that child. Okay, if the child is in preschool and has not had an ETR completed yet, call your school district and ask for one. So if you believe your child has delays, you've already been told that, or you have a doctor saying that they're delay areas, you can request the school district to complete that evaluation team report. That is the report that we're going to use to look for those 2 delay areas. That's typically the only report we need for the 3 to 5-year-olds. If you have that, that is kind of like your golden ticket. If there's two delay areas in there, then that child is going to be eligible. Okay. We can use, if the child, you do not for some reason want an ETR completed, that's okay. If your child is receiving OT, PT, speech from an outside agency, a community agency, you would just need to send us all of those records. So if we can verify that the child sees an OT and a PT and a speech, then there's likely at least 2 delay areas that child has if there's a need to see all of those therapies. Doctors can also provide us with documentation for delay areas because they can complete assessments. So we would take their documentation as well. But we do encourage the ETR process just because it's going to provide a lot more information and get you a lot more supports than just us. So then I'm going to talk about the age 6 and up age group. This is a little bit of a different age group. So from 6 to 15, what we are looking for at this age is a clinical diagnosis. So if a child has delays from 3 to 5, maybe autism is suspected, but at age 6 is when we're actually going to look for that autism autism diagnosis. They've had an assessment completed. We're going to need that diagnosis. Then we're going to administer the Children's Ohio Eligibility Determination Instrument. This is called the COEDI. This is a determination instrument that all 88 counties in the state of Ohio use. We are required to use this. We are trained to administer the COEDI assessment, and it evaluates major life areas of activity for the child. I'm going to get into exactly what those are and kind of some of the things we look for when we're asking those questions. We are looking for 3 substantial functional limitations. So there are 6 areas in the COEDI that we assess. We're looking for limitations in 3 of those areas. Then at age 16, we're still looking for that clinical diagnosis. Does it exist? Did it exist at age 6? There's likely we can use that documentation from age 6. with then some current information. So we won't make you go, if you had an autism assessment completed and you already sent it to us at age 6, we're going to be able to use that autism assessment at 16. We are then going to administer kind of the adult version of the COEDI, which is called the OEDI. The only difference between the COEDI and the OEDI is an extra area that we assess, but we're still looking, so there's 7 areas on the OEDI, and we are looking for 3 limitations still out of those 7 areas. And I'm going to talk with you about kind of what those look like. Anything you want to say?
16, that updated ETR. You mentioned the autism
Yep.
evaluation, but not the, we'd want that.
Oh, yeah. Yep, I'll do that. Yep.
Okay.
All right, so let's talk about, this is how we determine, this is the assessment that we use and the major life activity areas that we assess. So we are looking at mobility, receptive and expressive language, self-care, self-direction, learning, capacity for independent living, and then those for 16 and up, economic self-sufficiency. So a couple of things about these areas, these life areas. We are asking questions that are typically geared toward the age of the child. What is a typical child at age 6 should be able to complete? What is a typical child at age 16 should they be able to complete? Can they manage some spending money in their pocket? So for economic self-sufficiency, no, we don't expect a 16-year-old to be able to pay their own bills and do everything on their own, but they should be able to kind of manage some spending money in their pocket reasonably. Can they go make a small purchase at, a little store? Can self-care, can they brush their teeth without needing a very long time to do it or a major prompts or, kinds of things like that. Receptive and expressive language, can they be understood by others? Can others, do they understand what others are saying to them when communicating? What I want to note here is that each of these 6 to 7 areas all have a subset of questions within them. So it's not just, I'm going to ask this question and they can't do one thing, so they get an SFL in it, a limitation in it. That's not the case. So we have to score the assessment, meaning we have to look at each yes and no question and then make a determination on that particular assessment. So just because a kid does not brush his teeth well may not give him an SFL in that self-care area. There's other components that we have to consider. We also look, when we're completing the assessment, we also look for how this child performs these activities across environments. So how does it look at school? How does it look at home? We also want whoever knows the child the best to give us that information. So we do an in-person assessment to observe the child. We talk to the parent to say, what does this look like at home? Help me, piece together, this child's life. And then what does it look like at school? The ETR can usually help us with that, but if not, we can talk to the transition coordinator. We can talk to any school staff to kind of get a good picture of what that child's school day looks like. So we will kind of, make sure it's a holistic approach as far as how we're viewing that student and not just in one environment. Okay. So I'm going to walk you through what the eligibility process kind of looks like from start to finish. And if there's things that you don't understand here, please feel free to ask questions, but I will have time at the end, I promise. At this part in the eligibility process is when we're going to assign a support administrator. So my intake staff are going to call, they're going to talk with you, get as many documents as they can, they're going to explain the process, and then we get you assigned. So this is when the support administrator is going to assist you until a determination has been made. The first thing that they're going to do is request that documentation if you haven't sent it in already. So some of the things that they're going to ask for is a release of information. The release of information is really important because if we are struggling to get documentation maybe from a school district or a doctor or a hospital system, having that release can allow us to kind of maybe, help move that along a little bit. I will tell you that even with the release, the best way to get this documentation is for parents to ask for it because you're first person. Sometimes hospitals get funny even with the release of whether they're going to release, especially psychological documentation. That gets kind of a little funny. But we do have good relationships with school districts and good relationships with the hospital system, so we've been pretty lucky. So that's one thing that we can do to kind of help you is to get that release signed and say, hey, they've really tried. What can we do as the agency, involved to try to get these records? We are going to need a birth certificate and a social security card, a copy of those. And then we're going to need the documentation used to verify the qualifying diagnosis. So these can come in the form of clinical reports, hospital records, school records, diagnostic evaluations, psychological evaluation, full-scale IQ testing, and adaptive behavior scores. So I'm going to just mention that just a little bit. Some school districts do complete full-scale IQ testing as part of the evaluation team report. I'm going to recommend that if that's completed, that the school, we talk to schools a lot, and we talked with them about the fact that we cannot use brief testing. So it has to be a full-scale IQ. Schools tend to want to use the brief because it meets their educational needs, which is totally fine. The problem is it doesn't qualify for us. We need that full-scale IQ. Typically, when a school district does this in the ETR, they will also do adaptive behavior scores. That testing goes right along with the IQ and can really help us determine that threshold of an intellectual disability or not. And then audiology or vision records. Like I said, those records are important because there are some speech and hearing and vision conditions that are qualifying. There are certain thresholds and levels, so a mild hearing loss may not qualify, but a significant hearing loss. We would need those test results from those audiology and vision reports to show what that looks like.
Excuse me, if I
Yes.
can clarify something.
Yeah.
Support administrator, I want to enforce something you have on, sorry, maybe not the right word. Until a determination has been made, that would make sense why we lost our support administrator after the reconstructing of the delays last year, and the loss of actual support administrators that you guys have within the buildings now.
That's a great question. Those are two separate things. So county board eligibility is separate from whether you have a support administrator or not. So once you become eligible for county board services does not mean you are guaranteed a support administrator. It means if you need one and you're having, significant need as far as needing resources, needing getting connection, and needing lots of supports, then you can ask for a support administrator to be assigned to you. That is separate from eligibility. So once you're eligible for county board services, you may not need a support administrator. We have lots of kids that are eligible for services that only get family supports and don't have a support administrator. So maybe they only need a few, maybe they need some equipment or they need paid, camp paid for or something like that. They won't need a support administrator for that. But if you're concerned about the fact that you don't have one now and you need one, all you have to do is call the county board to ask for one.
We got a letter saying that we were losing ours because of the restructuring that you guys had done last year within the building. The initial essay that you had told me that she even existed 2 years ago, and then her job got reassigned somewhere else into the building. We got reassigned to somebody else. So I apologize for invading on this right now.
No, that's okay. Yeah.
It's based on our personal experience.
Sure.
What you were saying with continued support administrator support doesn't fit what like the discontinuation of our severe needs that we have that I've had to do.
Well, then I would absolutely recommend that you call our eligibility line and we can get you reconnected with the support administrator. Okay? Yep. And I can give you that card after the presentation with the number on it to call.
Sorry, a similar question, but more just general. Like, how do you know if you need one or don't need one? As an important administrator?
That's a great question. Usually, that's something we can kind of help you determine. We will ask you what it is that you're calling about. So I'm going to talk about the services that we provide in a little bit, but we will kind of talk you through that to help you know whether you need one or not. You can always ask for one. There's nothing wrong with asking for it, but a lot of times the support administrators need to do active planning with the child. So if there's really they're just kind of hanging out and not doing a whole lot for that child, they may say, we're going to close for now, but if you need us, call us back. Most of the time, the students that are eligible for County Board services use our Family Supports program, and that pays for so many things that you don't need to have a support administrator for. You just go directly through Family Supports. And so I'll talk a little bit about that. That's what most kids, receive services for. But if you feel like you need one, reach out to us.
Yeah, no, I only asking because I don't know what I don't know. So when our
Yep.
daughter was 3, we had one, and she was helpful.
Okay.
But as we kind of learned all of the therapies and things,
Mhm.
we also lost her. But I think it was okay because now we can kind of navigate it
Yeah.
on our own, and then I don't know what I'm missing out on if we don't have one.
I wouldn't say you're missing out. I think if you're feeling lost, if you're feeling like I need resources and I don't know where to go, if you're feeling like your child's declining or you're just not well connected, then I think the support administrator role is kind of the main point of coordination. So they coordinate all kinds of services. So they may pull in family supports, or they may pull in, maybe you need your home modified. They may pull in those, services. So they can pull in lots of different people and have one point of coordination. But if you're really only needing camp to be paid for and you're really kind of good, where you're at, then you might not need a support administrator in that situation. Great questions. All right, so let me talk about a little bit more about the documentation that we're going to be looking at. So once your documents are sent in to us, we're going to review them. Support administrator is going to look them over, and they're going to see what it is that we have there. So one of the biggest things is making sure that we get complete assessments that are signed by the doctor. They have to be signed. They can be electronically signed, but they have to say that somewhere on that document. So it either has to be an actual signature or it has to say electronically signed by Dr. So-and-so. So that is one thing that is a requirement in the state that we have assigned.
The pediatrician or with the doctor?
Good question. It can be a pediatrician, it can be a neurologist, it can be a psychiatrist, psychologist. It has to be a licensed professional able to diagnose that condition. Okay? So, for example, cerebral palsy. If that is a diagnosis that child has, I cannot accept a diagnosis from a psychologist about the cerebral palsy because it's a medical diagnosis. So I have to get an MD, PCP, certified nurse practitioner we can now accept, which is great. So we can accept those. So we need something documenting that this child was born, from this doctor, was born with this condition. So yes, but any medical professional who is able to diagnose that particular condition.
And just correct me if I'm wrong, I
Yep.
think it has to be within there's a certain time frame, right? If the kid was born and got that diagnosis, then you started to apply when they were 13, it has to be within a certain number of years, or could it?
So let's talk about that a little bit. So first of all, when we're going through the eligibility process, the child must be diagnosed with this condition. It must be manifested. Let me use that word, not diagnosed necessarily. It must be manifested prior to the age of 22. So we have to see in some way that this occurred prior to the age of 22. if someone has a traumatic brain injury at 25 and they were typically functioning all through school, we're not going to be able to support them because it has to have been diagnosed prior to the age of 22 or manifested. If a child receives a diagnosis of autism, and they receive a diagnosis maybe later on in life, maybe 23 they receive an autism diagnosis, what we're going to need to have is documentation showing that even though the child was not diagnosed until that time, how was that child affected? What did that look like for that child's schooling? So if they have a diagnosis of autism at age 22, it's likely they experienced these symptoms long before that, they just weren't officially diagnosed with it. So we have to show school records, we have to show medical records, we have to have a doctor saying, yes, this manifested itself prior to 22 and this is how. So if we can have that, then that's something we can verify.
But does the documentation have to be?
Okay, yep, let me go to that second. Okay, so for an autism assessment, if a child gets an autism assessment, I'm going to use this as an example and then I'm going to move on to another example. If a child gets an autism assessment done at age 3, then that assessment is going to stay with that child throughout. So we're going to look at that again at age 6, we're going to look at that again at age 16, and I'll talk about more why in a minute, those ages, but we're going to be able to use that assessment at age 3. Okay, that particular thing does not need to be current. What does need to be current though is how that child looks with that diagnosis today. So one of the most common ways for us to see that, if a child was diagnosed at 3 and now they're 16, is for an ETR. So I'm going to tell you that it's very important for you to consider not waiving the evaluation team report. If you waive it, then it's very unlikely we will have something showing what that child looks like today.
How current it has to be ETR?
I'm sorry?
How current it has to be ETR?
So it depends on the situation. We want the most current ETR. So if you had one done and this child was 3 and they had an ETR at 3, we're going to want, and they're 16 now, we're going to want to see that most recent ETR.
So at least 6 months old is okay?
Yeah, they're done every 3 years. As long as it's within that 3-year period, then we consider that a current ETR because you can't have another one done before that 3-year period's up. So they're done every 3 years. So if it was done in 21, it's still current today, even though that was 2 years ago, because that's the most recent ETR you have. You can't have a more current one than that. But I will tell you, please reconsider waiving. I know that school districts, may come to you and suggest that you waive the ETR because not much has changed or not. I would just encourage you to not do that. And one of the reasons is because, first of all, it's going to affect county board eligibility. The other thing is it could affect other services that you get, like ABA therapies and things like that. It can impact other services that you could be eligible for if you waive the ETR for your child. So I'm just going to kind of stress that. If you have more questions about that, let me know. But we do, from time to time, hear parents that say, "Well, no, I waive that." That's fine. That's your right to do. But it can't. We often don't have then something to use current to show how that child looks today. So, yeah.
I just kind of want to rephrase what you're saying.
Yes.
I'm a parent, but we're also intervention specialists.
Okay.
It's not that families are waiving their ETR, they're waiving new evaluations to be done. So like if the district is saying to you, we're just going to do a records review and not do a new IQ that's what you're waiving. That's what you don't want to say yes to. The ETR is going to take place every 3 years if you're going to keep your IEP no matter what. So you're not
Right.
waiving your ETR. You're waiving the new.
Thank you for clarifying that. That's correct. However, I want to be careful with that though, because if the ETR that is current as of today references way old data, we're still going to struggle with that. I'm still not going to be able to use that.
Do a records review and
Correct.
the information we had from 3 years ago. And that's
No,
not.
you need new testing. You see a school psychologist, you see typically an OT, an intervention specialist, you see a whole team of people when you do that ETR, right? So we're gonna wanna see new assessments. They can reference older ones, that's fine, but I also wanna see new testing in there. These ETRs are so valuable to us that's why I'm kind of spending a little bit of time on them, because they really are valuable documents. And so I don't want to have to send you for more testing. That's what's gonna happen. Is that I'm gonna, I may have to send you for additional testing to be done because maybe it wasn't done recently from the school district. So that's kind of what we're trying to prevent here. Other testing is fine though. You wanna go to another psychologist, you wanna go to someone else to get this done, that's totally okay and that's your choice. I just want you to be aware of what we're going to ask for when it comes to eligibility. I don't want there to be surprises. Thank you for bringing that up and clarifying that. That's correct.
Excuse me.
Yeah.
So basically, I'm lucky, we've only been here for 2 years, we already got an ETR done because we're gone over people or, oh boy, I constantly praise them. So, if this age 6, you're saying, has to be done within 3 years, if it's already been 2, like, we should be good to go when she turns 6 in a couple of months.
If it's still current, when was the ETR completed?
Within 2 years.
So it really just depends on when it was done. If we're counting 3 years after, some of 21s are coming due, in 24. So depending on when that ETR was completed, it doesn't always align with when we need to complete eligibility, but we will work with you. We'll know. We'll be able to know and to be able to tell you. It looks.
You're going to be calling us then.
If you're going through the eligibility process, yes, we're going to be helping you and saying, oh, you should have been due for a new ETR. Did you have an IEP meeting recently, or do you have one scheduled? And then, and then we can also reach out to the school districts with a release and say, hey, what's the current ETR for this child? Yeah.
In the cover of your IEP, each IEP has when your next ETR is due.
Yeah, I must have missed that one little box.
Yeah, it's okay.
Yep.
There's a lot on that cover.
Yeah.
We have a lot of info.
It is a lot. Yep. But we can help you. We can help you figure that out, and the school can too. They can tell you when you're due next. Do I need to cover anything else? Couple things about documentation. I did want to note, the reason I'm spending a lot of time on this is because this is typically the place where people get stuck. This is a place where, kind of the process takes the longest, okay? It's getting this documentation, getting the right documentation, and it can probably be a little frustrating for you as a parent. So that's why we want to make sure that we're helping you through this process and helping explain exactly what it is we need. So that's what the support administrator's role is. So for autism and ADHD, we tend to have stricter criteria that we need to follow with regard to both of those diagnoses. And so we do have forms that we send to the family to take to their doctor. It's a document that says exactly what the doctor needs to send to us. If a child is diagnosed with autism, our recommendation is always to get them diagnosed as soon as possible. As early as possible, and get them diagnosed through a full evaluation process. And that means Cleveland Clinic Autism Center, UH Autism Center, Metro Health Autism Center. I would recommend one of the agencies that completes the full autism assessment evaluation, because once you get that, not only does it help with county board services, those assessments can help with accessing ABA therapies. So some of the doctors will write a one-pager and say, this is how they meet criteria for autism. It's a one-page thing, and it doesn't provide that full assessment picture, that they will not qualify for ABA under that one-page assessment. So if you're needing ABA for your child, you're going to want a full assessment to be completed. It doesn't have to be one of the major hospital systems. We have others that we use, but those are the most comprehensive, and they know exactly how to assess these kids. They're great. So if you're struggling with that, let us know. There are some wait lists, involvement with those. So that's why we encourage people to start early. Babies are getting diagnosed at 18 months. So if there's suspicion there, if there's, but most of the time it's by 2 or 3 now. Like we're seeing some wonderful autism assessments that are being completed for kids that are early on. And that just means they're going to get more support. So,
How current has to be the evaluation report?
I'm sorry?
This autism evaluation report, how current it has to be?
Well, that's what I was saying. If it was completed when the child was 18 months, and you're
We produce at the age of 14?
at the age of 14, no, we can use it any time. As long as that's completed, we can use that at any time during the child's life. Yep. So those autism assessments are very valuable to us and to you, because it does open you up for more services. So, all right. So there are times when we're going to ask for additional information. So maybe one of the reports, maybe it's an ADHD assessment, and the child is diagnosed with ADHD, but they're also diagnosed with intermittent explosive disorder, anxiety, depression, post-traumatic stress. Okay, so kids can come in to us with multiple diagnoses. Those diagnoses that I just mentioned, other than the ADHD, are all mental health diagnoses. They do not qualify for us. So intermittent explosive, post-traumatic, anxiety, depression, oppositional defiance disorder, all of those types of things are mental health disorders. On their own, they will not qualify for county board services. You have to go through the Board of Mental Health to get services. If there's an ADHD diagnosis, for example, we're going to ask for documentation that shows that this diagnosis of ADHD, what it looks like, the current symptoms, how it's being treated, how it's looked over time. Maybe they were diagnosed at 6, are they still diagnosed at 16? And how that diagnosis affects this child's, how does that ADHD diagnosis kind of manifest in that child? Meaning, if a child has multiple diagnoses, we need to sort out kind of what those symptoms are attributed to the ADHD. So we're going to need something from the doctor stating why all of these behaviors that this child has, all of these symptoms they're exhibiting, is a result of the ADHD and not post-traumatic stress and depression and anxiety and all of that. So ADHD is one of the most difficult because it can present in lots of different ways. And so we really do have to try to tease out from that doctor whether it's really attributed to the ADHD. Is it attributed to the attention deficit, hyperactivity, or is it because of some other coexisting condition? So typically medical doctors are able to give us that statement, but it takes a lot to get that from them. So that can be a little bit of a time issue when it comes to going through the eligibility process. So we're going to ask for more in those situations. We also do have a behavioral health unit that we have psychologists a part of the county board who kind of help us look at documentation when maybe some of the documents are conflicting. Maybe one says one thing and one says another. So we do have some psychologists on staff who, in special situations, can help us review documents. We also have nursing and speech. So we will pull them in if the documents that we're getting are just, we're not sure how to interpret them. So they're a great asset to us, but that does take a little bit of time in the process. While we're doing all of this, just rest assured that if we're working behind the scenes to kind of get your documentation, we're not just gonna close you out. We're gonna make sure that you understand what's happening in the process and what the outcome is and what next steps are, okay? If we get to the point where we have enough documentation, that's when we're gonna schedule the assessment. Schedule that in-person assessment. Typically, it can be one of our buildings. Typically, we schedule them at one of our buildings. We have east side, west side, downtown locations. We can make special exceptions if the parent, to accommodate the parent and student if we need to. But typically those are held in person at one of our buildings. And then the support administrator is going to score that assessment. Once they score it, they're going to share the outcome with you. They're going to then talk to you about next steps. If it's an eligible determination, they're going to talk with you about what it is you need. So while we don't have a menu of services, you can access our website and see kind of some of the services we have, and I brought some of the kind of overview of services over there. We don't have a menu. It's all based on assessed needs. So what does your child need today? Because what they need today, they may not need down the road. But what are the supports that can help you and your child, kind of have their best life? We're going to try to link to community resources. So whether your child's eligible or not, we're always going to try to link you to other communities, resources that can help you. So we're not the end-all be-all here at Cuyahoga DD. There's so many other agencies that we will want to encourage you to tap into, whether you're eligible or not. So we're going to try to provide you with as many places to get connected. And then we're going to link to County Board services and supports. So what can we do at Cuyahoga DD to help support you? I'm going to talk about what those look like a little bit. But I just wanted to move on to the redetermination process. So I'm not sure if you're aware, and if you aren't, please take note that the state of Ohio does require all children to be redetermined at the ages of 3, 6, and 16. So it's a requirement that they have to go through redetermination. This is a huge developmental period for a child, so the child's can change dramatically during these ages. So it's really important that we redetermine County Board eligibility and see what the child looks like now. We can also determine eligibility. We can relook at eligibility if a child has had a significant change in functioning. Maybe they were able to do some things and now they're no longer able to because of that diagnosis. Or maybe they were not able to do some things and all these supports have helped them and they've just progressed, and maybe now they don't have those limitations that they had before. So in those situations, we will relook at eligibility.
This redetermination will not be done after the age of 16.
Typically, once the age of 16 happens, we wouldn't redo eligibility again unless someone said this child has changed or this adult has changed.
Someone means who is this?
Could be anybody. It could be a parent saying my child has changed significantly. It could be a school. It could be us, based on maybe we've been involved with this child for so long that we've done assessing and we're like, this person can do all of these things. So we might need to look at eligibility again.
But
that doesn't happen.
possible.
It doesn't happen very often that we do that. It can happen. So once, yeah, it can happen. But once you're done, once you kind of have that last redetermination at 16, we don't relook a whole lot unless something has changed to the negative. So if a child has really, they could do a bunch of things and were found not eligible, maybe it's at 10, and now all of a sudden they can't do what they could do before, then you're gonna want to call us. You're gonna want to let us know that something changed with this child. Maybe it's a new diagnosis at 16. Maybe it's just a decrease in functioning because of their disability. So we want to know anytime something changes with somebody.
Excuse me, I have another question. Your linkage to community resources.
Yes.
And linkage to TV service support, we have clearly fell through the cracks of support. Whose job is it to help us with community resources? Because outside of Regano, I'm on my own.
Okay. So again, that could be through the support administrator. It could be through our family supports program. It could be anyone at the county board can really help link people to services. So it really it's going to probably mean you reaching out to us to say, this is what I need and I feel like I've fallen through the cracks and I need some help. And here's the areas where I need some help or my child needs help.
Of course, thank
Yep, absolutely. So, redetermination process. We start this process 3 months before the child gets ready to turn that age because we want to make sure services continue. So we send out a letter, redetermination application and a letter stating it's time to redetermine the child services. So it's very important that the parents respond to that letter because you want to continue county board eligibility, okay? So we will start that process. We're going to need then updated documents. We're going to need the most current ETR. We're going to need any new diagnosis or documents that the child has received. And then a new release of information. Our release of informations typically are only good a year, so we'll need an updated release. Anything about that?
Just the 16-year-old redetermination, there's a really like a 50% response to those. So just to emphasize making sure when you get correspondence from us to read it and just really stay on top of that because, because at 3 and 6 you might not necessarily get somebody looking over that, but at 16 I do kind of keep an eye on those. And I just see a lot of people don't often check their mail or read their mail or just realize the importance of it or maybe think that, okay, my child won't turn 16 for another 3 months, so I've got time. So, but it's really important to get those, read your stuff, and respond to it as quickly as you can. So again, things move quickly and are completed before the birthday.
If you've moved and we don't have current information because you hadn't needed any, call us. We'll be, it doesn't have to be this paper application you fill out. That's what you're going to get in the mail. But if you just want to call us and say, hey, I know my child's getting ready to turn 6, I want to continue. That's all we need. We just need your verbal. We need something saying I want to continue so that we can get the process started. Okay, so don't get hung up on the paper. If you didn't get it, but your child's getting ready to turn this age, call us. Yeah.
Very simple question. If it was painless, so if I'm getting family support, it's likely that I went through this. Is that a true statement for an 8-year-old who would have done this at 6?
Yep.
Okay.
You would have done this at 6. You could have done it at 8. I don't know when you came into us, but yes, we would have done the co-edi with you, and you won't need to do anything now until 3 months before your child gets ready to turn 16. So you're good until that. If for some reason your child was found not eligible at age, maybe he had it done at age 8, was found not eligible. If you feel like something has changed with your child at age 9, call us. Like, you don't have to wait to 16. Call us the minute you think or suspect or know something has changed with your child and you want us to kind of take a look at it.
My son is turning 15 by next month, April 25th.
Okay.
So far, we have not updated it. So every time he has been diagnosed autism well before. I think by school itself diagnosed. So whether that won't be helpful, we have to go to Cleveland Clinic and get diagnosed.
That's a great question, actually. So schools, when children are classified under an autism category at school and a school psychologist signs off on it, that is a that is a diagnosis that schools use to put a child in a specific educational category. So we typically, that's not something we're going to be able to use on its own. We're going to have supporting documents with it. So sometimes the schools are great and complete an ADOS. We use acronyms. An ADOS, it's a tool. It's an assessment that's used for autism. So some schools will complete this assessment within their evaluation team process. We can use that ADOS, that assessment, but we're going to need some other documentation as well. So, it's very possible that you might not have to go to Cleveland Clinic, but we're going to need to look at that assessment and see what it contains and what you would still need.
No, if I put a release form, you can't get it from the school, or we have to get you may directly get from the school, right? If I sign on the release.
The ETR? Is that?
ETR, everything.
Mm-hmm. Yeah, you can get it directly from the school and ask them to send it to us, or you can email it to us, or you can sign a release and we can try to get it.
Okay, one more thing is, a typical case, school is classifying him as autism, and we are taking to Cleveland Clinic. They are telling he's a normal boy. Is it possible? Just I'm asking. He's not qualified in autism. Whether will they tell like that?
Oh, Cleveland Clinic has told you that?
No,
You mean?
First I'm asking.
Okay.
This is all my wish kind of thing. I don't want to be my son to be classified.
Sure. So it's, the school is going, the clinic, whoever completes that autism assessment is going to look at that, the ETR, that they're going to want to see that. They're going to bring in their own, kind of review team, but they're also going to want to look at how that child looks at the school setting and what has occurred in the school setting. So I'm not saying it's not possible for the Cleveland Clinic to say your child's not diagnosed with autism, but he fits under an autism category at school. It's possible. We've had those conflicting things happen.
So what is your decision in that situation? How do you proceed? So which one will you take?
We can use the school's stuff for supporting documentation, but we would still need something showing that the child actually has the clinical diagnosis of autism.
Because I'm running out of time, so I don't think that whenever I call the Cleveland Clinic, the line is big, but they will give appointment after 2 or 3 months.
Mm-hmm.
Now my son's date of birth is falling on April 25th, so he will become 15 years.
Mm-hmm.
So I want to get so 15 years is a different qualification, right? So I want to, at the age of 15 here, it has to be different. You are putting some kind of, at the age of 15, you do have different.
Right? So that's for us. So that doesn't mean at 15 he can't get diagnosed with autism from one of the hospitals.
At the age of 15.
He can
Yeah.
get the doctor's diagnosis at any point. It doesn't
Yeah.
have to be at the 15, 16 cutoff for us.
Okay.
Yes.
Right, doctor.
Yep.
And we are taking the pediatrician. Pediatrician is recommended. That certificate you won't accept, or you want to be evaluation of the Cleveland Clinic or
Not
psychologist.
a psychologist. So there are other agencies. There's an agency called LifeStance. There's an agency called Centers for Effective Living. There are other agencies that diagnose autism. So I don't want to lead you to believe that's the only one. That's just typically the most common. But there are other agencies that diagnose, and they typically have a psychologist on staff who complete that full assessment.
Okay.
We can give resources afterwards.
Okay, perfect.
We got extremely lucky that not only did they catch the initial autism diagnosis, but we got further genetic testing to show
Yeah.
that we basically got turbo autism. That's what we call our daughter's Rett's diagnosis. So,
Okay.
yeah, they
Mhm.
did a really good job catching
Sure.
that on.
Yeah, neuropsychology departments are great. They are used to completing those as well. So a lot of, you get familiar doctors that send us the reports. So, we know, kind of who those are when we see them, who, just you kind of trust that doctor has thoroughly, what we don't, and it's not that I don't trust other doctors, it's when we get a one-pager, that's a kind of a red flag for us of just this person is diagnosed with autism. What did you use? Like, we need to see what you used to diagnose. How did you come to this diagnosis? What was your criteria you used? So if you can send us all that one pager then can go with that other paperwork, but we need the full picture.
Now one more question, sorry to bother you. 2011, sorry. Somewhere in 2011, your member from your team came to our home. And they did their face was something discouraging tone, and we were so hopeful, and they told that a discouraging tone, and they left. He may be qualified kind of thing. So, but those records will be in your system.
Yes, we keep records of anybody that has ever come through our front door, whether the person's eligible or not, or we keep a record of everyone. So we can look back at your record and just see what happened. I apologize that was not a positive experience for you. We definitely want to make sure that we're
We didn't want to hear
doing
that
that.
kind of news at that time. That kind of.
Oh, sure. Yeah, absolutely. I get that. But yeah, we will have you, if you've come to us before, your information will be in our
Came
system.
to our home.
Sure. Yep.
They visited our home, and then our friends are told, why did you allow them to get into a home kind of thing? It's kind of going to barber and asking whether do I need a haircut kind of thing. immediately they will tell us you need a haircut kind of thing.
Okay.
I,
No, that's that's probably not very hopeful.
okay. Right. Sorry to the.
No, you're fine. These are great questions. You guys are you're fine. Okay, so I'm just going to talk a little bit about the services and supports. We're almost finished here. I appreciate your time. We're going to talk about the services and supports that we typically offer. Again, it's not a menu, but it's some of the things that people typically access. So when someone is found eligible, we can link them with these types of supports. One of the most common I mentioned was Family Supports Program. Some of you may know this or think about NEON. This is our funding. NEON is our biller. Okay, this is our money. We're giving you for family supports, and they help us with billing. Okay, but they can pay for camp. It can pay for respite. It can pay for home mods, equipment, specialized medical equipment. It can help with recreation activities, things like that. So that is a wonderful program that the majority of kids access. Support administration is another services and support we offer, and they can bring in a lot of these other types of services and supports. What I do want to mention about behavior curriculum intervention, behavioral health, OT, PT, and speech, nursing, and assistive tech. So typically these services are not direct therapies. Okay, so this is not an OT coming into your home and providing additional hands-on OT services. That has to go through your insurance and through your doctor. You need to access a community occupational therapist for that. Our occupational therapists can come in and they can do an assessment and make recommendations. They can consult with you. They can work with you in the home to say, why don't you try these strategies? But they can't come into your home and provide ongoing therapy. They can also coordinate with the schools and other kind of therapies to talk with them about the recommendations they're making. But again, they don't provide that direct 3 times a week, 1 time a week service. Okay?
Excuse me, I'm confused.
Yep.
You're saying about occupational therapy, physical therapy coming at home. The last time I was told when I reached out to them in order to get any services, I apologize, I'm not
You're okay.
direct in my verbiage sometimes. Basically, what got explained the last time OT came to our home, they were like, we're here on an as-needed basis.
Yes.
You want us to get you Chewies, a wheelchair, a mount for the eye gaze, we got you, but then we close your case again.
Correct.
And you reach back out to
Yep.
us when you need a scan. Otherwise, as far as these suggestions, I could really use them.
Yeah, they can recommend sensory equipment. They can do all of that. They can't provide ongoing occupational therapy on a
Pretty much
weekly.
just told them what
Yep.
I needed. There's
Yep.
no recommendations.
Okay.
So maybe we just didn't get a good one there. But, okay, and the family supports NEON. You still got Erin there, right? Erin Lambert?
Erin is at NEON.
Zachary's
She,
not there with us.
yeah, I don't know. Again, they're a partner agency. They just process our bills, so we don't typically work directly with them. We do have a family supports staff, so you can contact them directly. So we have 2 coordinators now, and one is bilingual, and we have an assistant in family support. So we've taken on more of an active role with family support, so you will probably want to reach out to one of them instead of NEON. Yeah, so those are some of the other supports that we can provide depending on the needs of your child.
Question on family supports. How do you determine which tier a family gets? You know what I mean?
Yeah. So there's 2 typical funding ranges for family supports, and it is based on taxable income. Again, that is decided by Family Supports through the application. You can apply online if you're eligible. And
500 or 1,500.
yeah, $750 or $1,500 is typically the amount.
What
Yeah,
is the amount?
700. No, it's a year. So Family Supports goes from January to December, and it's either $750 for that period or $1,500 for that period.
Only to that extent you will, Cuyahoga Board of Disability will pay?
So yeah, we have, so if it's like respite, then we have contracts that we can pay directly for that service if you wanted to utilize the respite. Yeah, so there are things that we would pay directly. There are certain situations that you can be reimbursed for, depending on what it is. But I would always talk with Family Supports about that because that's their area of expertise. That's not mine. Yeah.
There's a mom who couldn't make it here tonight. She was sharing with us, she has 2 children that receive family supports. She received, one receives the $750 and one receives the whatever, $1,250, $1,500, whatever it is. But they became eligible at different times in the year, I believe. So
Interesting.
she was wondering if it's possible because her income changed, like maybe she reported an increase in her income when she applied for the second child. Would that be
Possible. She definitely should call.
Mhm.
She should definitely call somebody in Family Supports. Yeah, to say why is the difference.
Yeah.
Yeah, it's very, yeah, it could be at the time the application was made and what she said. We don't make you verify your taxable income, so we just say, what is it? And, so, yeah, if she just happened to mention that it was higher or lower or whatever, yeah.
I said, hey, the $5 could have made the difference.
And we need to make sure those 2 kids are connected in our system. We try to connect siblings. We ask about that all the time, but it's really important for just consistency of, so we would want to make sure that we do that. So you can call Family Supports directly. The numbers I think are on,
There's a family.
they should be, okay, I was going to say they should be over on those brochures. Should be,
Yeah, there's a phone number on here.
does it say 2947?
No, 736.
Ah.
Oh, that's an eligibility line.
Yeah, is there a 2947 on there? Oh, I need them to update that.
But maybe on one of the things I did.
On the card here, excuse me, if I could double check on something.
Uh-huh.
As I mentioned, we fell through the cracks of like a lot of the services that we need for our child. The policy manual for January last year, it says on the file of the complaint form, it links the policy manual for, is that what I should refer to,
No, I think really all you need to do is get our eligibility card over there and call us and ask for a support administrator and explain why you want one. That's all you have to do.
Like I said, we just got a letter out of the blue saying that I don't
Right.
need for your services, we got shut down, like, all the restructuring that you guys were doing last year.
Yeah, and any time in the future if that happens, anybody can appeal. So you can, if that were to happen again in the future, you can file a complaint resolution or a due process if it's a Medicaid service. So there is always an appeal process, and that should always come to you in writing anytime something closes. So if you got the letter saying you no longer have a support administrator, you should have gotten a complaint resolution paper with that.
It could have been included, unfortunately, I was probably too mentally ill or depressed to follow through with that.
That's okay. All you need to do is call us.
This McRae Bonnie, is that the complaint person to reach out?
Bonnie McRae, she is somebody in human resources, yes. I don't know that, you can file that, but I think she's going to link you to me. So, we're the front door, so, I want to help you get connected to services. So that's my goal, is to help you get the services that you need. So if you want to take my card and you want to take the eligibility card, all you need to do is call us and we'll get you connected again.
Okay, I just haven't been functional enough to try and reach back out to you guys to figure out why we got a letter out of the blue saying, hey, we're shutting you down.
I can't answer that at the time, and it's been a couple years, right? When was it?
Last year, I think
Yeah.
we got our letter after we lost the initial lady that,
Okay.
maybe me and you had the same one?
I completely understand. They're just so overstaffed and there's so many kids.
Yeah.
So if you're not using the service, we were not using it a lot.
Yeah,
So it was
yeah.
totally okay for us
Yeah.
to get the letter that said you won't have one.
Yeah, we have
And
ours.
then we haven't needed one. But
Yeah.
if you need one, I would say just reach out to
Yep.
Amy and make sure that you get back on the list.
Yep, that's not a problem. Anytime anybody wants a support administrator, we'll be happy to to get you connected. All right, I'm going to talk really quickly about, this is my last slide, about how to contact us. So a couple things I want to bring up here is, first of all, on your slide is the number to Bright Beginnings. So that's anybody up to age 3. So 3 and on comes to us. So birth to age 2, that's who you'll contact. If someone wants to apply for county board services, we have 3 ways to do that. You can call our eligibility line. You can apply on our website, which is, the link is here. Or you can email us. We do accept third-party referrals on behalf of, sometimes the schools submit a third-party referral, a doctor, a social worker, a neighbor, a friend. Anybody can submit a third-party referral. What I'm going to tell you about that, though, is that we do have to get parent consent. We cannot proceed with the eligibility process without talking to that parent. So it's important that that parent knows, you as a parent, it's important you know that somebody's making a referral on your behalf. So they should have talked to you about that. They should have said, hey, I'm calling the county board. I'm going to make a referral on behalf of Johnny. Are you okay with that? And you should say yes or no. So make sure you're aware of it and make sure you want to participate in it. Because if we get a referral from a school and the parent does not want to follow through or, says no or hadn't been contacted and had no idea why we were calling them, which happens all the time, I don't want to be a surprise to people. Okay, so there's a specific question on our application that says, does the person know that you're making the application? So please say yes and be honest about it.
So I actually refer quite a few of my students, but many families have a language barrier or cultural barrier. So in an IEP meeting or in a conference, they might say, when I've explained all these amazing things that you guys do, and they might say, like, yes, we need them. And I say, okay, I'm going to put the referral in. Someone will call you in about 2 weeks to schedule the evaluation. Then that person calls, and sometimes what happens is the family doesn't understand who's calling or where they're calling from. So would you suggest, should we reach out to someone in particular and just kind of give a heads up and say, hey, I'm referring this family. They do want your services, but they might not quite understand who you are when you call.
Yes. So I would put as much detail. Yes, I would give as much detail as you can when you apply. There's a comments box. There's a box that you can just type. Put family needs interpreter. Family is going to need extra support through the eligibility process because they may not understand the process. So feel free to put those kinds of things so that we know we may have to go above and beyond to help support this family because they don't have the resources or ability to do so. So yes, we have Language Bank that we access all the time. USCRI, which is an immigration agency, we access them for every language you can think of, and they help us interpret. So we also have Spanish-speaking staff. We do have a few other bilingual staff, on our staff, but primarily, we're going to be able to get connected to, that family and be able to communicate with them in a language that they understand.
Families that you can tell them all of this, but they need somebody literally to walk them.
Yeah.
They need somebody to sit them next to them as they say, like, you need this document or you need this document, and then that's where it stops. Like they're oh yeah, sure, and then they don't continue it, or they don't follow through, or when they get the phone call, like you said, then they don't call them back, and then you're like, well, what else can we do?
Yeah.
I maybe putting that in the thing, like there needs to be somebody that's sitting next to them, or
And
you
it
meet them at a library, you meet them at a
And
Honestly, that's what could have helped us,
Yeah.
or what I'm kind of asking for. We didn't know that with the restructuring of your program last year that we had to keep calling in for occupational therapists, speech therapists. I'm losing all my therapies right now. We didn't know we had to keep calling in for that, and I just thought, well, I'm just not going to keep calling.
Yeah.
So that's
Sure.
pretty much why we fell through the
yeah,
cracks.
you have to be
Yeah.
because,
Yeah.
I can be a thorn when I'm not on the couch.
that's
Yeah.
the thing that I think you have to keep calling because
Mhm.
that's okay.
Yeah. Yep.
You have to know that.
Yep.
And it's also really, if you're making referrals for families and you think that there might be a barrier, it's really important to include a release of information. You can attach those to the referral, because we can't reach back out to you to say, hey, we're running into a brick wall here. But if there's a release, then sometimes we're able to, say, I see you made this referral with the best intentions, but we're not able to communicate. So then we, bring it back to you and hopefully close that gap. And I have blank releases, so if you're not familiar with that form and you need some, I brought some with me.
So we need them to complete your release, not our release.
It doesn't matter.
Okay.
As long as there's if there's any
both.
release that they have signed, we'll accept it.
Okay.
But we need to have something in order to report back to you that we're hitting barriers.
Yeah. And, at the end of the day, I mean, our responsibility is to report. We can't always report back to every third-party referral because we get so many. We do have a duty to report back to the parent. They're our main, primary person to coordinate or, to communicate with regard to the eligibility process. But if they're struggling, we would want to know that. We would want to be able to kind of support in whatever way we can. So just let us know that there might be some extra support that's needed. We can't make people do. If they have too many things going on in their life and this is just one more thing, they may have to prioritize what's important for them at the time. But just know that we will be here. We're not going anywhere. If things calm down in a month, call us back. We're not going to make people complete the process and add stress to their already stressful lives. That's not our intent. So, yeah. My contact information is there. We do have brochures, cards. If you have any specific questions, feel free to reach out to us. We will be happy. Yeah.
I do have a question.
Yeah.
And this might not be the right department.
It's okay.
Every now and again I hear about waivers, and then they say you have to be eligible through the Cuyahoga, I think this group. Can you talk about what I need to know about waivers?
I can talk generally.
General.
Yes, because waivers are very Yes, waivers are very complex, and it's going to vary based on the person, the need, all of that. So let me just kind of talk with you. First of all, yes, you need to come through county board eligibility and kind of be found eligible for county board services, and then we will assess your need. What is important to know about waivers is if you're going to want to be very honest about the services and supports that you need for your child. Okay, you're going to want to be very transparent about this is where I'm struggling, and here's documentation, this is all the help I need. Because what we're going to do is anybody can ask for a waiver at any time. So so then what happens when a parent does that is we complete what's called a current needs assessment. It's called a wait list assessment. They've renamed it, but it's called a current needs assessment. So we basically go through all of your current needs and we identify what are the current needs, what are the challenges, what are the issues, where are the safety concerns, and then we look at what can meet those needs. Can we meet those needs we have to try to meet needs the least restrictive, or the least, not restrictive, but the least, we have to consider other options first before we go to a waiver.
I don't know if it's ever been defined for me what a waiver is. It's sort of like this mystical thing that's hard
Okay, I can, yeah. Yeah, that is a great question. I'm assuming all of you know what a waiver is. So waivers are, the way waivers started where they were brought into play in order to keep people out of institutions and waiving an institutionalized setting for services, meaning I want to receive services in my home, I need more care, it's going to be cheaper for me to receive services than an institution, so I'm going to waive my right to go to an institution. That's where the waiver term comes from. People don't associate that with what a waiver means to them. Well, a waiver means funding and dollars and Medicaid, but that's how it originated. Okay, so basically, it can provide services in your home for homemaker personal care, for transportation, for lots of different waiver services. It is paid for by funding through Medicaid, but we administer the waiver. The county board does. So we have 3 waivers we administer through Medicaid. Yes, correct. We are not the primary funder of Ohio Rise. So there are other agencies that, so that's not
I've
an,
been waiting 3 months for anything.
Yeah.
So I can get better psychiatric care, and I haven't gotten any respite provided to me or my daughter. So I definitely will reach out to you so I can maybe find these other respite providers and do
Sure.
care for my family.
Okay. Yep. So we don't administer administer the Ohio Rise, funding. So that actually you have to go through a completely separate process for that. You have to go through a different assessment process. So it's different funding because it involves state funding. It involves funding through all kinds of different agencies: mental health, us, state, Medicaid. Like, there's a lot of people involved. These are for pretty intensive kids. So. But the waivers that I'm kind of talking about are kind of just the more general that provide support in the home. That typically kids don't a lot of kids don't have waivers, and that's because most of the services can be provided and needs met in other ways, whether it's through the school district, whether it's through our local funds. Family supports, there's lots of other kinds of funds that we can access before we go to a waiver. I'm not going to say it's not possible, but we would administer that current needs assessment to determine what kind of funding can meet this need. And if it's determined it's a waiver, then we would go through the waiver process and the waiver enrollment process.
Is it all income-based as well?
No, that is not. No, that is not income-based. That is based on, you get funding based on the waiver type and funding based on the needs of the child. So the different way.
Administrator would help locate
Yes.
that, right? So I-
Yes. Anybody on a waiver has to have a support administrator. So,
Kids who are autistic are kind of getting support through school. And is that sort of considered what they would get? So like if we're paying out of pocket
Yeah.
for additional things, that would be out of scope for a waiver, I'm assuming?
yes, probably. The school district has a responsibility to provide certain things to the child, so we can't overlap that. So we have to be very careful that we can't authorize a service that the school district is responsible for providing. If there's extra supports that are needed, like ABA, again, that would go through like insurance and kind of things like that.
As far as the ABA goes, when we did Help Me Right Beginnings, we actually back then qualified for Polar funding. Is that only an early intervention option, the payer of last resort, or is that available to families whose insurance do not cover ABA?
I'm not familiar with Polar.
I think it was just for
Did you use Polar too?
Okay, I'm not versed on EI because they're completely separate. So it very well could be. I do know that a lot of families access BCMH for some other things to pay for other. It's extra insurance to pay for some of these other things. So that's somewhere that we recommend parents get involved with if they can. But I'm not familiar with that one. As far as that's not something I've heard from 3 and up. Any other questions that you have? Yeah. Thanks.
The nice thing about tonight is just seeing a lot of us already have our kiddos in the Board of DD system already. And it's great going forward. We know what needs to happen at the next level. The information that we received tonight is invaluable. For those that are not using the Cuyahoga County Board of Developmental Disabilities yet, I urge you to definitely take that step forward because hopefully you can see all the great things that they provide in our community and in life in general. So for those that are watching through the video, please check out their website. There's great resources there. This information will be found on the open Facebook page, SE's TV, and the PowerPoint presentation will be available soon on our Facebook page. Thank you, Amy. Thank you, Amy, and thank you to the Board of Developmental Disabilities for all that you do for our children and our community.
Thank you.